Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what the PCDH19 gene is, the genetic mutation of PCDH19, symptoms, seizure types associated with PCDH19, seizure clusters, diagnosis, and treatment options. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. PCDH19 epilepsy is a type of epilepsy caused by a mutation of the PCDH19 gene on the X chromosome. The PCDH19 gene results in epilepsy by encoding the protein protocaterin 19. PCDH19 epilepsy begins in the first year of life and mainly affects girls. Boys may also be affected, but it is much less common given that the gene is tied to the X chromosome. PCDH19 is often accompanied by differences in development and features of autism spectrum disorder. All children with PCDH19 epilepsy have a mutation in the PCDH19 gene. The PCDH19 gene encodes the protein protocaterin, which is responsible for cell communication. Mutations to this gene affect the communication of neurons with one another through cellular interference, leading to epilepsy and associated neurodevelopmental conditions. Since the PCDH19 gene is located on the X chromosome, the extent of the mutation varies by sex. Since a male has an XY genotype and a female has an XX genotype, females are more commonly affected, while males with one copy are typically unaffected. Approximately 95% of PCDH19 epilepsy patients are females and 5% are males. Around 70% of patients with the PCDH19 mutation have an intellectual disability ranging from mild to severe. The course of development for intellectual disabilities usually occurs in one of three parts: normal development from infancy, but with regression after seizure onset; normal development and intellectual ability from birth without regression; delayed from birth and remains delayed into adulthood. Psychiatric conditions and symptoms include autism spectrum disorder, behavioral problems, aggression, ADHD, ADD, anxiety, and obsessions. In adolescents and adults, depression, bipolar disorder, schizophrenia, psychosis, and other mental illnesses have been reported. The following physical symptoms can be present with PCDH19. Ictal apnea. Individuals stop breathing during seizures and have rapid and sometimes prolonged oxygen desaturations. Sleep disturbances, trouble falling or staying asleep. Fine and gross motor deficits, language delay or nonverbal, sensory integration issues, dysautonomia, and hypotonia. The following types of seizures that occur during PCDH19 are generalized tonic-clonic seizures, focal impaired awareness seizures, tonic seizures, clonic seizures, complex partial seizures, atypical absent seizures, atonic seizures, and myoclonic seizures. The most common feature of PCDH19 epilepsy is seizure clusters. Seizure clusters are the occurrence of seizures that come in heavy, grouped amounts across days or weeks and do not respond well to medication. Characteristics of seizure clusters are: the first seizure occurs between 3 months and 3 years of age with an average of 9 months, starts usually in the setting of a fever, and later they come with no known trigger, often drug-resistant and hard to control. Sometimes loss of hearing and loss of skills are experienced after seizure clusters. The appearance of seizures during the first year of life produced by an illness or fever, known as febrile seizures, may suggest PCDH19 epilepsy. The occurrence of many seizures in a short time frame, followed by a break from seizures, may also suggest PCDH19 epilepsy. The following tests may be conducted to confirm A diagnosis of PCDH19. Genetic testing. A DNA test can determine if the PCDH19 gene is mutated. EEG, electroencephalogram, often used to track electrical activity in the brain by measuring the electrical impulses in the brain. MRI, magnetic resonance imaging, is a medical device that creates images of your organs and tissue throughout your body. It uses magnets and radio frequency to create an image. An MRI is a painless procedure. Treatment for PCDH19 epilepsy will depend on the type and severity of seizures and associated neurological features. Anticonvulsant medications, rescue therapies for seizure clusters, dietary therapies such as the ketogenic diet, vagus nerve stimulation or responsive neurostimulation. Family support is a crucial part of treating epilepsy. Parents and caregivers must be aware of symptoms, seizures, and how to respond. Taking care of a child with epilepsy can be extremely tiring. To manage life and treatments, families can seek psychosocial support, develop an appropriate education plan, and access available community resources. Genetic counseling is also recommended. Additional therapies such as physical, occupational, and speech therapy may be beneficial in helping to treat cognitive issues and developmental delays. Talk with your neurologist or epileptologist to see if this is an option. In conclusion, PCDH19 epilepsy is caused by a mutation in the PCDH19 gene. The mutation affects the protein protocatenin 19, creating cellular interference between brain neurons. The most common symptom of PCDH19 is seizure clusters. Treatment for PCDH19 and the corresponding neurological functions will vary based on the severity. Still, it is generally treated with a wide range of therapies, anticonvulsant medications, and devices. To learn more about PCDH19 and epilepsy, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.